and welcome to today's webinar organized by the Filipino Nursing Diaspora Network, together with our partners, the Nurse Party List, and the Philippine Times, as well as the Beta Nu Delta Nursing Society. Our topic today is the effects of mindfulness program on hypertension, a guideline approach, and this will be delivered to us by Dr. Lea Gayrama Ramos, DNP. Myself, Dr. Kilat, and I'll be your host and moderator, and we are very excited to be hosting this session today. Today's webinar will be held for the next 60 minutes. It will be started with a 20-minute presentation by our guest speaker, followed by question and answer session for the maximum of 20 minutes. We have a good number of participants for today's webinar, both from the Philippines, Indonesia, in the US, and as well in Australia. We are joined by Dr. Lea, Dr. Kilat, Dr. Ramos is our resource speaker. We also have Dr. Soriano, Dr. Yaguno, Dr. Evangelista, Professor Babate, Dr. Violeta Lopez, and Dr. Jacqueline Cablio. So currently we are in good numbers. And so before we go further with our presentation, I want to review the functionality of the Zoom platform. Your active participation is important throughout the session. Right now, I have everyone on mute to avoid background noises that may distract you from listening to the webinar. Throughout the presentation, someone on staff will be managing the chat functionality. You can enter your questions and comments in this question box throughout the presentation. If it happens that you would rather ask in person, you can also ask the icon on the control panel to raise your hand to indicate that you have a question. Once you raise your hand, someone will unmute your line so that you can ask your question. Dr. Kilat? So before we start, I would like you to introduce our guest speaker today. She is a board-certified family nurse practitioner and doctor in nursing practice with specialty in leadership. She also studied nursing in the US and has been working in her nursing career for 29 years. She started working as a registered nurse on a medical surgical unit, then to CCU and cardiac unit at the University of Pittsburgh Medical Center, Pennsylvania. She relocated to Las Vegas, Nevada, and worked in ICU, CCU, heart transplant unit in Summerlin Hospital. She has been a nurse practitioner for 13 years now. During her NP career, she became assistant manager of operations and then clinic manager at Minute Clinic in Las Vegas, Nevada, as she managed 9 medical clinics. She became the CEO and managing director of Rainbow Clinic and Holistic Yoga in 2004. Then, the first clinic in the United States where medical clinic and holistic yoga were in the same location and managed by a nurse practitioner. She is a yoga master and a Tai Chi practitioner, black belt, and her DNP quality improvement project is focused on primary hypertension within the primary care settings. She chose mindfulness as her non-pharmacological approach intervention. She integrates her passion for mindfulness to achieve a positive outlook in population health. To give us more about mindfulness, our resource speaker for today, let us welcome our very own Dr. Lea Gayrama Ramos.
Thank you. That was nicely done. Hello, welcome everyone. I'm so grateful to be here. I'm talking to you from Las Vegas. As I said, it's a Friday night here, 7 p.m. I know it's Saturday morning there. And I'm looking forward to sharing this information with you. And the goal for today is, after my presentation, it's pretty much just like 15-20 minutes. I would like to give you mindfulness training so you can experience it. And some of you already told me that you're interested in mindfulness or doing mindfulness, which is really awesome. And because I really want you to utilize or use mindfulness training to yourself, to your family, to your friends, especially with this pandemic. It's really important right now because what is this? Anxiety, fear is gripping our society right now. So mindfulness can also help the physical and mental health of our population. So I really believe in this. And the reason I picked, before I start, I'm just going to give you a nutshell. I picked hypertension because they already heard that I really love cardiology. Since I graduated nursing, I already knew I'm going to be a cardiac nurse. So I stayed in cardiology, and then I did, so that's why I picked the population health of hypertensive patients, because I've seen it a lot. In my career. And I also chose the mindfulness intervention because as a yoga and Tai Chi practitioner, I saw firsthand the positive effect of it. So, and I saw it, I have members that I was able to let go. I mean, they were able to stop their blood pressure medications, patients with what you call that, anxiety, they're taking antidepressant, they were able to be off of it. So I was able to see it first, and I said, oh my gosh, this needs to be documented and presented to the scientific community. This is a scientific community. That's why I'm so grateful that I'm able to give this chance. So that's why I chose hypertension and mindfulness. So I'm going to get started because so we have enough time for the training and then for the answer on question. Okay, let me share my PowerPoint. Here we go. Okay, you can see that, right? And you can, my voice is okay? All right. All right, so I'm gonna get started. I'm gonna try to read my notes so I don't, because I can speak all over the place. All right, introduction. Now, hypertension is an asymptomatic condition that eventually affects the quality of life of the affected individuals. According to CDC, 1 in 3 US adults have hypertension, and globally, 1 in 5 adults have hypertension with complications. Hypertension can be controlled through medications and lifestyle modification. Background: hypertension is a leading preventable risk factor for cardiovascular disease and deaths. Common treatment for hypertension are pharmacological and non-pharmacological approaches. Pharmacological therapy is the preferred treatment. However, non-pharmacological intervention is now recommended either alone or in combination with pharmacological therapy. Non-pharmacological therapies such as lifestyle modification, stress management, mindfulness training are recommendations that help lower blood pressure in hypertensive patients. The main points of this project are as follows. The medical providers experienced mindfulness training, and after the mindfulness training, they disseminated the evidence-based mindfulness educational guideline tool to all their primary hypertensive patients for 6 weeks. The aims of this project are to enhance providers' mindfulness experience and to lower high blood pressure in patients with primary hypertension. And both goals were successfully achieved by this project. The Project Pearl is to continue disseminating the mindfulness intervention after the project to all patients that may benefit from it at the host site. So my project was only for the hypertensive population, but once the project was done, they can disseminate it to everyone in their clinic. It could be the patients with anxiety, depression, chronic pain, because mindfulness can benefit everyone. The significance of the host site. The host site is a primary care medical clinic in Las Vegas, Nevada. According to the stakeholders, who is the owner of the clinic, 50% of the patient population has primary hypertension, and 25% of the population have uncontrolled hypertension, even with a pharmacological treatment. This host site did not utilize mindfulness as non-pharmacological intervention until this project. Literature review on mindfulness. Aims of hypertension management are to decrease mortality and inhibit hypertension-related diseases. Studies have shown that mindfulness program improves hypertension and other chronic diseases such as chronic pain, diabetes, and anxiety, depression. Mindfulness program is becoming popular due to its easy access in group classes, online resources, and digital media. It is easily taught to children, adults, elderly, people with physical limitations, mental health issues, and chronic diseases. Mindfulness program has also a positive impact on health promotion and disease prevention. Problem statement: hypertension is a major public health concern and the third leading cause of deaths worldwide. It is also a major risk factor of global cardiovascular disease, mortality, and morbidity. Cost of hypertension-associated hospitalization is rising, and it is accountable for approximately 9.4 million deaths annually in the world. Purpose statement: the purpose of the project is to reduce high blood pressure in hypertensive patients by implementing an evidence-based mindfulness training program educational guideline at the project site. The project question: will implementing a mindfulness training program educational guideline and measuring providers' mindfulness experience be beneficial in patients with hypertension over a 4-week period? Project objectives. The first one is to develop an evidence-based mindfulness educational guideline tool. So you have to do research and put it all together. The number 2 is to improve providers' mindfulness experience. And the third one is to evaluate the effectiveness of mindfulness educational guideline tool on patients with primary hypertension after a 4-week period. Theoretical frameworks. Pender's health promotion model was utilized to promote healthy lifestyles. Healthy promoting behaviors such as mindfulness help create new healthy behaviors and positive health outcome. In addition, the Donabedian model was also utilized to guide the implementation process of this project. The 3 essential elements, which are structure, process, outcomes, were identified as quality assessment guidelines. This model was utilized as a measurement of outcome for patients in health promotion and disease prevention. The project design and method. This project is a quality improvement with a goal to reduce high blood pressure in patients with primary hypertension. So that's part of the inclusion. The patient has to have a primary hypertension. If they have the secondary hypertension, such as they have high blood pressure because of pregnancy, they cannot be included. Or they have hypertension because of brain tumor, they have to be excluded. It's really just a primary hypertension. And the mindfulness intervention, it is a non-pharmacological approach and evidence-based guideline tool utilized in this QI project to improve medical providers' awareness in mindfulness and to decrease high blood pressure in patients with primary hypertension at the host site. Mindfulness training program. Multiple studies indicated that mindfulness training decreased blood pressure in hypertensive patients and improved other chronic diseases as well. It is an increased awareness of the present moment through focused attention. It is a direct reflection of current sensory and mental occurrence without interruptions and without judgments. It cultivates the mind's ability to influence bodily functions. Mindfulness practice is a combination of mindful movements, mindful breathing, body scanning, mindful eating, mindful walking, mindfulness of thoughts and emotions. So during the mindfulness training, we're gonna focus on the mindfulness movements and mindful breathing. Implementation. The providers experienced the mindfulness training twice, 1 week apart, and they answered a pre and post mindfulness attention awareness scale survey. Then, after the mindfulness experience, the providers disseminated the evidence-based mindfulness educational guideline brochure with free scientifically validated resources to all primary hypertensive patients for 6 weeks. Part of the inclusion, the patients has to have a systolic blood pressure of greater than 140 or the systolic blood pressure over 90. I know the regular blood pressure now is 130/80. I chose to go higher, so I have more leeway for my data. And patients with systolic blood pressure greater than 140 or diastolic blood pressure greater than 90 during the initial visit were asked to return in 4 weeks for a nurse visit to recheck their blood pressure after they implemented the mindfulness intervention at home. So the providers just have to give them the brochure, and the patients have to do their own mindfulness training at home. And we asked them, they were asked to return in 4 weeks as a nurse visit, so they don't have to do a copay anymore. So they just have to pay one time. And the AMR chart audits for pre and post blood pressure readings were done. So I did the audit myself. And the paired t-test analysis were utilized to evaluate the pre and post evaluations. This is the results. The MAAS survey was utilized to evaluate providers' mindfulness experience before and after the mindfulness educational training. The paired t-test analysis was utilized for comparison of pre and post MAAS survey. Paired t-test analysis shows a p-value of less than 0.05, illustrating a significant improvement in providers' mindfulness experience after the mindfulness educational training. Patients with systolic blood pressure greater than 140 during the initial visit returned to clinic after a 4-week implementation of mindfulness intervention at home. Paired t-test analysis was utilized to compare patients' systolic blood pressure reading at initial evaluation and again at 4-week interval. Paired t-test analysis of pre and post systolic blood pressure readings show a p-value of less than 0.05, illustrating a significant decrease in systolic blood pressure readings after a 4-week implementation of mindfulness intervention. The average decrease of systolic blood pressure was 4.5 points. Patients with diastolic blood pressure greater than 90 at initial visit returned to clinic after 4 weeks implementation of mindfulness intervention at home. Paired t-test analysis was utilized for comparison of initial evaluation and at 4 weeks interval. Paired t-test analysis of pre and post diastolic blood pressure readings show a p-value of less than 0.05, illustrating a significant decrease in diastolic blood pressure readings after a 4-week implementation of mindfulness intervention. The average decrease in diastolic blood pressure was 4.93 points. These findings are comparable to the studies of Bell, Point Marquis et al., Solano, Lopez, and Wright et al. Implications for nursing. This QI project provides a non-pharmacological approach and lifestyle modification mindfulness techniques that is cost-effective, easy to perform, without adverse effects, and show a positive outcome in a short period of time. It also improves the quality of life of the hypertensive patient population. The limitation of this project, though, the number one is time, because it's only 4 weeks. The healthcare providers disseminated the brochure for 6 weeks. But if week 1, they came to the clinic, they have to do the training themselves at home for 4 weeks. So if they came on week 4, so they have to do the 4 weeks, so they were not able to be part of the data anymore. So the healthcare providers did give 100 brochures to all primary hypertensive patients, but after 4 weeks, only 30 participants returned. And some of them couldn't return because some of them got admitted to the hospital, so they were not able to do the mindfulness training. They were not able to continue it. And some of them did not have transportation, so they have other issues. So, and that is okay. So that was part of my limitations. Conclusion. As hypertension continued to rise globally, it is vital to manage it through pharmacological and non-pharmacological methods to decrease its morbidity, mortality, and its increasing healthcare costs associated with hypertension. This QI project was utilized by the medical providers who successfully disseminated the mindfulness intervention to the primary hypertensive patients at the host site. The results showed a significant improvement from pre to post evaluation. This QI project showed that implementing the evidence-based mindfulness intervention enhanced the provider's mindfulness, and it decreased the high blood pressure in patients with primary hypertension. And that is the end of my presentation, and thank you all for listening. Yay, I did it. And this is my contact information. Thank you. And if you want to send me an email, you can do that. Okay. So I'm going to stop the share and so I can see all of you. All right. So now I'm going to proceed to do a mindfulness training. Okay. I'm putting you guys on speaker view. So I can see all of you, So first of all, we're gonna do. I'm only gonna give you a brief mindfulness training. So have fun, enjoy, and keep an open mind. If you can put yourself on the video so I can see you, it would be nice. I can see Violeta and Cindy. That's good. First, we're gonna do a mindful movement and then a mindful breathing. If we are so tense, we cannot do a mindful breathing. So we need to relax first, right? We have to release those tensions. If you're so stressed out, right? You're so tense. We're holding too much tension in our muscles. So first thing we need to do is release. We hold a lot of tension in our neck and in our shoulder area. I'm gonna go farther so you can see me. So first thing we're gonna do, we're gonna try to release tension in our neck. So we're gonna do some mindful movement. So follow me, you can see me, right? So you slowly move your head up and down like you're saying yes. This is good for your first cervical spine. Mindful movement, focus on your neck. Let's release tensions in your neck. Keep breathing out in your mouth. Ah. Thank you for showing your video. Keep breathing out. Ah, feel your neck. Yes. And then slowly move your head like you're saying no, side, left to right, a different muscle group. Keep breathing out in your mouth. Ah, release those tensions in our mouth. Let it go. Ah, feel your neck. Very good. Now, slowly turn your head to your left side and then just move your chin up and down, different muscle group. Feel your neck. You might feel tense. It's okay, just breathe it out. We're trying to release tension in our neck. Last 3, 1, 2, 3. Very good. Now slowly return. Now turn your head to the other side, to your right side, and slowly move your head up and down, your chin up and down, a different muscle group. Breathe out in your mouth. Ah. Feel your neck. Release those tensions in your neck. Good. Last 3, 1, 2, 3. Very good. And slowly return. And now on your speed, slowly rotate your neck slowly. When you move your neck slowly, you can move the smaller muscles in your neck. You might hear some cracking. It's okay. Once you increase circulation, increase lubrication, that noise will go away. You're doing okay. Keep breathing out in your mouth. Be mindful of your movement. This is our mindful movement. And then slowly reverse, always even it out. Go to the other side. Breathing out in your mouth. That's how you release your tensions. 3 more. 1, 2. You guys are doing great. And 3. And slowly stop. Good job. Breathe in your nose. And breathe out in your mouth. Breathe in your nose. And out in your mouth. Good. Now we also hold a lot of tension in our shoulders. So let's release tensions in our shoulders. Put your hands on your shoulder like this. And then slowly rotate. And then touch your elbows and then down. Feel your shoulders. You might hear some cracking. It's okay. Release those tensions. Breathe out in your mouth. As you keep doing this, feel the muscle behind you on your back, on your shoulder blade, and also feel your muscles on your chest. Let it go. Breathe out. We're trying to release those tensions. These are our mindful movements. 3 more. 1 and 2 and 3. Now reverse. Always reverse it. Touch your elbows first, all the way to the back, and open and breathe out. Again, open up all the way to the back and open and breathe out. Feel your body is getting warm. That means you're increasing your circulation. When you increase your circulation, you're enhancing your immune system. We need our immune system is strong right now. So keep going. You guys are doing great. 3 more times. 1, 2. Last one. And 3. Good job. And then just put your hands in there. And then just rotate, alternate. Feel your shoulders. Looser now, right? And you feel warmer, right? Are you feeling your body? Connect with your body. Feel your body, feel the condition. And then reverse the other way. Keep breathing out. Release those tensions in your shoulders, in your chest, in your back. Yes. Feel your body. Feel your body. Keep breathing out. Good. And slowly stop. Now slowly hold your wrist like this and move it behind you like this. And then turn your body to your left and slowly pull your left hand. Pull it down. Open up your side. Breathe out in your mouth. Don't hold your tension. Let it go. Again, breathe in. Pull it down. Feel your side. Feel your left side. Breathe out. And slowly, slowly return. And now reverse. Slowly turn your body to your left and then pull. Open up your left side now. Feel your body open up and breathe out. Again, breathe in, pull it down, pull it down, breathe out. Last one, breathe in, pull down, feel your body open up and breathe out. Very good. And slowly, slowly return and lower down your hands and slowly rotate. Feel your shoulders. Good. You're okay? You feel okay? You feel warm? Okay. Now, we're going to open our acupressure points. We have 365 acupressure points in our body. Our mouth is the biggest acupressure points. You will hear me say a lot, open your mouth, breathe out your mouth. That's how to release tensions in our body. So you heard of those acupressure points, right? People go to the acupuncturist, they poke it, they're pretty much opening up those acupressure points. We're not gonna use needles. What we're gonna do is body tapping. We're just gonna tap our body. You don't know where your acupressure points are, so we're just gonna open it, right? You feel tension in your body. Don't avoid. Tap it there, increase circulation, it will slowly go away. First, use your fingertips, tap the top of your head. This is a scientific community. That means we think too much, right? We do a lot of thinking. So when you tap, you feel pain, don't avoid it. Just keep tapping, release those tensions in your head. And tap on your temporal area above your ears, tap, release those tensions. If you have a headache, you have hypertension, this is a good to release tensions, open up those acupressure points. Keep breathing out in your mouth. Feel your body, feel your senses, and now tap your forehead. Tap your forehead. If you have sinus problems, this is a good acupressure points to tap. Feel your body, and now tap under your eyes. Cindy, you told me earlier you have allergies. This is good to open up acupressure points under your eyes. So tap this, keep doing this. Even if you do this 1 minute a day, this really would help open up your acupressure points. And then tap your cheekbones, your jawline. You have TMJ. Those are tense muscle, right? This is tapping like this. It would help release those tensions. Keep breathing out in your mouth. Feel your body. You have multiple muscles in your face. So keep tapping your face. Keep breathing out. Now chin up. Tap your throat. If you have hormone imbalance, you have thyroid problem, this is a good exercise. Just keep tapping and keep breathing out. Yes, you guys are doing great. Good job. Now, with your left hand, tap your shoulders. Tap your shoulders. It might be tight. Just keep tapping, increasing circulation. Open up, and now tap your chest. If you have asthma, you have respiratory problem, this is good tapping, naturally opening up your acupressure points. Feel your body. Keep breathing out. Very good. Now, reverse. Go to the other side. This is our mindful movements. We do this a lot in our yoga practice, in our Tai Chi, just to release tensions in our body. Now, tap your chest. Keep breathing out. Don't avoid the pain. Now both hands, tap your chest. And breathe out in your mouth. You have anxiety, right? You have tension. That's a lot of blockages in your chest. You tapping your chest like this, it helps release those tensions. Keep breathing out. Release it. Choose to let go. Choose to let go. Breathe out. Very good. You guys are doing great. 30 more seconds. Feel your body. Increase temperature in your body. Research showed you increase your temperature 1 degree Celsius. Your immune system improved 35%. So just tapping your body, increasing circulation, you're already helping your immune system. Very good. And slowly stop. Good job. And put your hands in your palms. And now slowly close your eyes. Feel the tingling in your body. We're gonna do some mindful breathing. Focus on your slow, deep job. How do you guys feel? Feel good? Okay. All right. I'm going to give you one more exercise. We're just going to do this for 15 seconds. This is a bonus. Okay. We're going to do a laughing exercise. I'm going to unmute everyone. Let's see if I can unmute everyone. I don't think I can do it. Oops. How do I unmute everyone? So anyway, laughing exercise. I wanted to unmute everyone because I want you guys to hear everyone's laughter. It really helps you release tensions. We're only gonna do it for 15 seconds. So just laugh. If you cannot laugh, just look at me. This is my landmark. You will just laugh. Okay, just 15 seconds. All right, start.
Doctor is the best medicine.
Slowly breathe in. In your mouth. Breathe in peace. And bring it inside. Breathe in joy. Bring it inside. Last one. Breathe in love. And bring it inside. And open your eyes and smile. And that's it. How was it?
Fine.
You did great. Thank
Very
you.
good. Thank you. Thank you.
The breathing, and then the laughing exercise. I do that a lot when I'm driving. I'm by myself. I just laugh like crazy. Just 1 minute. It will change your mental status. Literally, you can share it with your family, with your patients, especially the cancer patients. Oh my God, they need to laugh more. So if you have any questions, do let me know. Let me go to the chat room.
Okay, thank you so much, Dr. Ramos, for that very wonderful presentation. Thank
You're
you for
welcome.
the moving and body warming exercise that we have this morning.
Yes.
This is, I guess, very timely because the entire world is facing this anxiety brought by the pandemic, and that is one thing that we really need to change our perspective, starting with our mind. Okay,
Yes.
so yeah. So now we will go
I
ahead
agree.
and take some time for questions now. Just a reminder that please be sure to type your questions into the question box in your control panel, or you may raise your hand and we will unmute your mic. Go through questions with host asking them and presenter answering them. So Dr. Ramos, based on our chat, we had received 2 questions. So
Okay.
yes, let me read this. The first question was, or is, can meditation help reduce blood pressure in those that already require antihypertensive drugs? That's the first question. The second is, the second question is, could meditation enhance the effects of medication therapy, yielding a greater reduction in blood pressure than either would produce on its own? So that's the 2 questions that we received
Okay,
earlier.
great questions. I'm going to answer the first one. It does, the answer to those are both yes. The first one, especially this is a primary hypertension patients, right? High probability hypertension on this patient population group is because of anxiety. They're so stressed out. They're so, right? So when they do meditation, they do relaxation technique. So I just shared it with you. When you do slow deep breathing, when you are so tense, we are in that autonomic nervous system, the sympathetic nervous system, right? That's the fight or flight. This is our brain. So when you do slow deep breathing, it goes to that alpha level. When it goes to that alpha level, you help relax your mind, you help relax your body, and physiologically, it would help decrease the blood pressure, your heart rate, because of the parasympathetic nervous system is being activated. So when we were doing the mindfulness breathing, I already told you right away, you are now activating your parasympathetic nervous system. Because with our society right now, we're also busy. It's all sympathetic nervous system. This is we're doing like this. It's supposed to be balanced, sympathetic and parasympathetic nervous system. So if we activate the parasympathetic nervous system, it definitely would help the blood pressure. It will definitely help the heart rate. And those are the automatic immune system. So that's why the first thing we need to do is help relax our brain. That's why we're so focused on relaxing our brain stem. And the other question, yes, it does enhance. When I did my study in a primary care patient, a primary clinic, it's a quality improvement. It's not a randomized trial. So I did not manipulate the blood pressure. I didn't manipulate any variables in there. So patients that were already taking the blood pressure medication, as I said, 25% of those patient population were taking blood pressure, but still their blood pressure is still high. So the mindfulness we just added to their regimen. It's just a non-pharmacological treatment in addition to their treatment, to their pharmacological treatment. And then 4 weeks later or a month later, they came back and it did show reduced blood pressure points. And remember, it's only 1 month. I wish we could do it longer. 1 month, it already decreased some. Can you imagine if they do it in like 3 months, 4 months, 6 months, 1 year? And I shared at the beginning that patients, I have my yoga members, after 4 months of doing the Tai Chi and yoga practice, they were able to eliminate their blood pressure. So it will just help enhance it. So they're both okay, but once you start relaxing, the physiology of relaxation state, and that would help slowly decrease your blood pressure, then you might eventually be off of your blood pressure medication. So.
Okay, so that's it. Okay, so
Yes.
Thank you so much, Dr. Ramos. So for this time being, may we call in Professor Irene Mayo. She is a lecturer of the School of Nursing from Australian Catholic of Nursing, Sydney, to provide a reaction towards the presentation. So may we call in Professor.
All right. Hi, guys. Hi, Dr. Lea.
Hello.
I hope you all can hear me. I think
Yes.
that was fantastic. For me, I always like interactive sessions, and for you to present and also to give us some tips and tricks on how you conduct mindfulness, I think that's absolutely fantastic. It's so interesting, and I think it is very timely to recognize that something non-pharmacological, very easy to learn, can be offered during this time. And it's interesting because for one of the units that I teach in university, we do critical appraisal of a journal article for evidence-based practice. And what's really cool is that one of the articles we ask students to critique is about mindfulness as well. In order to manage their own stress levels for being in university. So I think, I really did enjoy this session. I think it was really interactive, and you bring so much energy, and it's a relaxing type energy and vibe that you bring to this room. So yeah, thank you so much. I thought it was really fun.
Thank you. I really appreciate your comment. And I am a doer. I just don't want to give information because information here, right? But if I give you the experience, it will stay with you. That's 100%. Why I'm asking, right? And then with that one too, you are right. The nursing students are so stressed out right now, especially everyone has to do the online, right? They don't know what to do. So my sister, she's also an instructor. So she's doing mindfulness. She's sharing because they don't know. So this is really an evidence-based practice. And it's so easy to do. Anybody can do it, but you have to guide them. You have to let them experience, because once you experience it, that's why I let you do the mindfulness movement, mindfulness breathing, because when you teach your class, you can start doing the mindfulness breathing. That would help them.
Definitely.
And stimulate the brain. They will be so grateful. They will be so grateful. That's why I'm also here in our state. I'm doing a lot of mindfulness for physical and mental health because of this pandemic. So I've been doing it for 2 months now. So they're actually asking me to share. And I am so passionate with this mindfulness because I've seen it firsthand that it really works. So everybody globally, everybody needs to know this. That's why I'm so grateful you guys are here.
So, my next follow-up question from that is, can you offer us additional support or resources so we can get more mindfulness from you?
Actually, I can share with, because when I did my mindfulness, the research, I got that mindfulness scientifically validated resource. This is from University of Massachusetts. It's 8 weeks program. But if you join that class, it's like $800, $500 to $800. Nobody's gonna pay that, right? So there's a group of people with money. So they open they just copy the same program. And it's still for 8 weeks. And then people that have money, they can just donate. So they're able to share it to others. That's what I found. And that's what I gave in my brochure. I put it in my brochure. And patients can just do it on their own time. As long as they do it 2 to 3 times a week, they can do it in the morning, in the evening. And as I said, it's an 8 weeks program, but we wanted them to check your blood pressure in 1 week, in 1 month, which is 4 weeks. Can you imagine if they finish the program in 8 weeks? I can guarantee you it will decrease the blood pressure even more. So I can share it with them because it's a free brochure. I didn't know. Oh, okay, I don't have it, but I will gladly share it with you. Yeah, because it's very good, and it's the mindfulness gurus that are really sharing it.
Yeah, thank you. And I think, while we can think about something like this mindfulness, in a way, being quarantined or put into isolation has actually kind of forced us to think about something like this.
Yeah, exactly.
And,
You're right.
Yeah,
You're right.
Yeah, taking advantage.
This is actually a good time to do it now. To share this, really, because everybody is so tense, right? A lot of people, they want to be outside. The anxiety, the fear, because they feel like they're all quarantined, right? They're so in a space. So helping them breathe, helping them, just like the tapping, right? Because your chest is getting congested, right? So just open, just release those tension. Just make a noise, release. And then you do breathing. It really makes sense. So I'm actually doing my yoga classes online. I'm doing it 3 times a week because we cannot go to the yoga studio. So we're doing that like this one, so they can see me go my own crazy movements. Thank you for your sharing.
Thank you too.
Okay, so thank you so much, Professor Mayo. And Dr. Ramos, we've got some questions over the thread. One is from Dr. Lea, and let me read to you. Regarding the protocol, the reading of BP once, and we need to read again after 4 weeks. BP readings vary a lot even within a day. So the question is, how did you control or maintain time equivalence and many physiologic and psychosocial status of the participants?
Great question. As I said, this is a quality improvement project. So I did not do any manipulation in the variables. So since I went to the primary care patient, the organizational leader told me whatever they're doing, they have to continue doing it. So, which is fine with me. When the patient comes to the clinic, the MAs check their blood pressure, and then they go to the patient, to the room to be examined by the doctor. So whatever was their blood pressure there, they just wrote it down. Then they get the brochure. The provider gave them the mindfulness brochure, and the patient goes home and they do their own mindfulness training. 4 weeks later, a month later, they come back. We do ask them if their inclusion criteria was in that 140 over 90. So they do come back. So patients that did not use the mindfulness training, their blood pressure was still high. So them doing the mindfulness training 2 to 3 times a week for a month, it did help them relax. So we see that 4 points down. So even if there were like 150 over 90, their pressure probably just went down to 145. It's still good because we saw that decrease. And then if they just keep doing it, it will eventually keep dropping down. So we didn't manipulate that their condition. Well, the patients that did get sick, they have to go to the hospital. So they were not part of the data. So they were not included in there. So, but the organizational leader was happy with the outcome, because patients, they were self-reporting when they came back. They were so happy that it helped them a lot. And then some of them were asking, can I share this with my family? They're out of state and I could send it to everybody. Everybody can do it. And so they were happy with that outcome, that after the project, the owner, the organizational leader, wanted to give it to all patients at the clinic. They could have anxiety, depression, chronic pain, all kinds, because mindfulness is for everybody.
Mm-hmm. Yeah, that's correct. No? So thank you for that, Dr. Ramos. Another question coming from Dr. Ibiza, Ruby Corazon Ibiza. She said that mindfulness involves paying full attention in the present moment. However, our mind is so strong to dictate our mood, physical and behavioral responses. So what advice can you give to those hypertensive individuals who are having negative thoughts at times that they can no longer give full attention to what they are doing? So she's asking for advice.
Yes, that is a great question. It's not just hypertensive patients. All of us have this like monkey thinking, right? Too much thinking. We're busy. Research showed we think 7,000 thoughts a day. It's all of us, right? So let's just focus on the hypertensive patients because of the population of interest. That's why we do mindfulness, because your brain can only do one thing at a time. If you are not moving, you're thinking too much. Pay attention. And if you're moving your body, you cannot think. If you're not thinking, you're helping your brain relax. That's how you can quiet all this thinking. That's why I let you move. I let you move. I let you move, right? Because I wanted you to stop your thinking. And you cannot tell your body, stop thinking, stop thinking, stop thinking, because you're magnifying that energy. So you're going to be thinking more. So here's the thing that you can do when you're moving. Any movement is okay. You can just move your body. That's mindful. That's dynamic meditation. We call it dynamic meditation. So any movement that you can do push-up, you can do squats, anything is okay, because you're helping your brain relax, and then you're not thinking. And also, when you're having negative thoughts, you can always stop it. Think of something positive. Like you're saying, oh my God, I'm so scared, I'm so scared. I say, I'm okay. Change it quickly. You can change your thoughts. I'm okay. I'll be okay. I'll be okay. Breathe. Focus on that breathing. You got it. That present moment, being present. So you can control your emotion. That's why your mindfulness of thoughts and emotions. If you know you're really paying attention, you go, oh, I'm feeling negative. Because whatever you think, your body will manifest it. So if you're feeling so afraid, fearful, you're going to be depressed. Like you're so fearful, so it will manifest it. So when you're doing all this starts in here, it didn't manifest yet. Start moving your body. Do something. Do breathing. And always send positive messages to your brain. I'm okay. I'm healthy. I'm healthy. Dr. Cindy Lee, you told me you have allergies, like, tap. I'm healthy. I'm healthy. As you keep moving, opening up, you're actually sending positive messages to your brain. If your brain is relaxed, it will soak it in as a sponge and it will believe it. Your brain will believe whatever you say. So you have to keep sending positive messages. It takes a while. It takes a while of training, but once you get to that level, I've been doing this practice for 10 years. So I already know, but even with that, I still have to go in and out. And also when you're doing meditation, your brain will go up. It keep thinking, you're doing this, right? You're doing it. Oh my God, I'm too busy. I have so much things to do tomorrow. Then just be aware. Go, oh, I'm busy. My mind is busy. Then focus on your body and do that breathing again. And then tell yourself, I'm okay. I'm okay, because we are the worst critic ourselves. So be kind to yourself. Love yourself first. Make sense?
Yeah, okay. Thank you so much, Doc. You know what, Dr. Ramos, we receive a lot of positive comments and commendations of the exercise we had this earlier. So thank you for that.
Yes,
there
welcome.
are still good numbers of questions coming over, and one is about I think from Dr. Lopez. The practice we did was the one you gave that patients with hypertension. How many sessions and for how long each session lasts?
Good question. As long as you keep your body moving, even if you start, because it's going to be hard to do 1 hour right away. Start low. If you can do 15 minutes, right? What we did today is only 15 minutes. Pick something. If you have a back pain, tap your back. If you have shoulder pain, tap. And always when you keep moving, always end it up with breathing meditation for like 5 minutes. Always breathe in 5 seconds, breathe out 5 seconds. Keep doing that. 5 cycles, that's a 1 minute cycle. And then because that helps your brain relax. So if you practice 15 minutes, even like you can do it in the morning, at night. Some people want to do it at night before they sleep so they can relax, especially people with insomnia, because your brain is too busy, right? You can do that. And some people, they start in the morning so they can increase their circulation, they can activate all their system. You can do it in the morning too. So 15 minutes, if you can do it 2 to 3 times a week, that will be good. I do mine every day. I do in the morning, and sometimes after work, I do it because I'm too busy thinking. So I need to relax. I need to unwind, let go of all that stress for the day. And so I do it in the evening too, but I don't take, I probably just do it like 20 to 30 minutes. If you can do 1 hour, would be good. So build it up. See how your condition is. Respect your conditions though. Some people, if you have arthritis, it's gonna be so hard. So this is gonna be hard for you. So go slow. Go slow, respect your condition. But if you do it daily, if you do it 2 to 3 times a week, your condition will improve and you will really see the change. So I would say do it 2 to 3 times a week. If you can do it daily, it would be good. The more you circulate, the better your body condition will be. And it doesn't matter what you have. It will help you physically, mentally, emotionally. It's a mind-body balance.
Okay, thank you for that. Dr. Ramos, yes. Anything to say before we wrap up, or something to wrap up with your presentation this morning?
Well, I'm so grateful for this opportunity. Thank you. And I am really happy that you have the scientific community and we're able, because I'm just guiding you guys, right? And then you will disseminate it to your patients, to your family members, to your friends. Don't hold it in. The only way we need to heal as one. Remember, everybody said, we need to heal as one. I cannot go through everybody. So whatever you learn today, practice on yourself first, see that positive outcome, and then share it to others. It's really through sharing. That's why I'm doing this, because I'm so passionate that this really would work. But I cannot go to Australia, I cannot go to the Philippines, I cannot go to Indonesia. This platform is really awesome because see, globally we're able to share like this, right? And if it works for you, high probability it would work for others too. So, and you don't have to tell them a lot of stuff, let them experience. That's why I let you experience, because through experience, they convince themselves. That's why I ask you to do the experience, because if you feel that mindfulness, you feel calm, you felt relaxed. I only taught you that 15 minutes. And always put that laughing exercise. It does wonders. Laughing even 15 minutes. Sometimes I would let them laugh for like 30 seconds. That's a lot already. 15 minutes just to release. It's really help you release all your tensions. So anything it's a mind-body balance. You can do all the exercise, right? But you're thinking, oh my God, this is stupid. This is so stupid. It's already in your mind. Your body is just gonna, wow, this is stupid. So your body will believe it, right? It's a mindset. It starts in the mind. I am wonderful. I am healthy. I am beautiful. Say all those positive messages to your brain, and your brain will listen to it, and it will manifest it to your physical health. So keep doing what you're doing, and let's heal the world. Locally, nationally, globally, we can do it. Thank you, doctors. I'm
Yes,
so
thank you so
grateful
much,
to be here.
Yes, thank you so much, Dr. Ramos. At this juncture, may we hear some parting words from Professor Violeta Lopez, the president of the Filipino Nursing Diaspora Network. Professor Lopez.
Mute. Hi, Lea. That's really a wonderful presentation with exercises. I agree with you that mindfulness is really, really important in patient care. So I mentioned before that we use it for our students, especially because they are stressed nowadays, as you said, online learning. And the clinical experiences or placement that our students experience is also a very, very hectic for them at the moment, especially now that they cannot go to the clinical area because of the pandemic. So we have to find ways on how to provide them with experience in the clinical area, which is really a need or a requirement for them to graduate. And it's true that mindfulness can be used for any type of health problem in patients. So we use that mainly for cancer patients. But when we started it with cancer patients, the caregivers and the family also wanted to join because they really need to accept the diagnosis and the prognosis and the survivorship and symptom management of patients, especially those suffering from fatigue and nausea and vomiting. So really, I really encourage all our members of this FiND network to find some ways to learn the training. I went on, I did my training in mindfulness when I was in Singapore. And so I actually practice it myself and provide it to my patients when I go. So this study, it's a practice development, isn't it? For a quality improvement program. I hope that you can publish it, because nowadays there's a lot of articles now that's coming out with an intervention that is non-pharmacologic. And for nurses, we can do a lot of non-pharmacological interventions for our patients. Thank you very much.
You are welcome. Thank you for your sharing. No, I did publish this one to, we have a doctoral repository.
Yes.
here in US. So it was one of our, before we graduate, we have to put it there. So we have to share it to the world.
And then
so
you mentioned also that you do Tai Chi. So we did use Tai Chi for our cardiac patients with the heart failure. It actually worked. We did a randomized control trial for that one.
That is awesome. And Tai Chi is so simple, right?
Yes.
It's a slow movement, but I always patients with anxiety, depression, I always tell them do Tai Chi, because through slow movement, their breathing moves, it goes slowly, and they can really, because when you're anxious, you're breathing fast, shallow.
Yeah, that's right.
So the Tai Chi, it helps you breathe, just like I told you, breathe in 5 seconds, breathe out 5 seconds. It really helps, it slow down your breathing. And it really helps. So I am grateful. The other thing too, sometimes we focus more on the students, right? We also have to help the teachers. They're just as stressed out too because of all the expectations. So we have to help everyone. And all the frontliners, they all need help. So that's why we just have to keep sharing all these tidbits of information. And it's really, they have to practice it though. Because if you just tell them information, they don't practice, it's equivalent to nothing. They have to practice it. They have to feel the difference in their body.
True.
Thank you.
Okay, thank you so much for the words, Dr. Violeta. I think it looks like we were able to cover all the questions. And thank you so much. Let me grab this opportunity to thank our partners, the Philippine Times, the Filipino Nursing Diaspora Network, the Nurse Party List, and the Beta Nu Delta Nursing Society, together, of course, with Dr. Lea Ramos as our resource speaker for this wonderful presentation. So thank you, everyone, and we appreciate you being here. Thank you very much for joining this webinar, and see you on for the next or future endeavor. So for this time being, we may also request everyone to please turn on their videos so we could have our group shot.
That's a great idea. And if you do have questions, you can email me. My email is smilinglea, SMILINGLEA @cox.net. If you have any questions, send me that email. I'll be glad to respond to your questions.
Yeah. Okay, so may we have now the group shot. So I guess everyone is but ready to share their video so we could have a shot this time.
Smile.